is key in the fight against the novel coronavirus pandemic. However, in Kenya, this sector seems to be the most struggling. Just recently, the Health CS Mutahi Kagwe announced the government's intention to implement a home-based quarantine protocol as a result of congestion in hospitals across the country. Saturday, President Uhuru Kenyatta announced the stay of coronavirus containment measures by the government due to the poor state of the health sector in the country.
Our healthcare system must be prepared sufficiently to take on a surge in infections. It must not be overwhelmed at any one point during this pandemic. Access to testing, isolation, and quarantine must be a bare minimum in our health facilities. This is not currently the case.
According to the president, most county hospitals are already dealing with a high number of patients and would therefore not be able to handle an increase in the number of patients should the virus spike.
Siaya County has only a 10-bed isolation facility, and already they have admitted 9 COVID patients from only one incident. Similarly, Busia County has a 34-bed isolation facility, and 2 days ago, that facility was full. So, fellow Kenyans, if there is a surge in infections in just these 2 counties, the healthcare system will most definitely be overwhelmed.
And despite the health CA's confidence in the implementation of the home-based quarantine protocol, the president seems to think otherwise, and he questioned the readiness of Kenyans in handling the protocol.
So the hard question to pose here is whether Kenyans are prepared to nurse COVID-19 patients in their homes if our healthcare system cannot handle the numbers. Are they prepared to expose their children, to expose the elderly to COVID-19 patients in the close proximity of home?
President Kenyatta also says despite the government setting aside 5 billion shillings to boost the county hospitals, their capability to handle more COVID-19 patients will take a while.
We have dispersed Kenya shillings 5 billion to the counties in order to assist them increase their healthcare capacity in view of this pandemic. But to build the necessary health infrastructure for such an undertaking requires time.
From the President's 8th address on COVID-19, it is clear that the health sector in Kenya does not have the capability to handle a surge in COVID-19 patients. Therefore, Kenyans will need to be more patient as a rise in these numbers could thrust the country into a twisted crisis. For TV47, I'm Zainab Mohammed.